next episode. You're watching Morning at NTV.
Welcome back and thank you for staying with us right here on Morning at NTV. My name is Romeo Busiku, and of course globally we are talking about 1,015,403 infections. 53,000 plus people unfortunately have passed on, but the good news is 210,000 people have actually recovered from the novel coronavirus. The United States is being battered the most with 244,000 plus infections, followed by Italy with 115,000 plus, and Spain with 112,000 plus. You have Germany following up with 84,000 plus, and then China with 81,000. They are lagging behind and they've stagnated as far as infections are concerned. Let's talk about human rights with Dr. Adrian Juco, but let me give you a brief preamble to this conversation. Well, the United Nations AIDS agency is calling on countries to adopt a human rights-based approach in responding to the global outbreak of COVID-19 that puts communities at the center and respects the rights and dignity of all people. In Uganda, claims of abuse of human rights, suspension of non-emergency court sessions, and the continued stay of prisoners who have served their sentences, among other matters arising, have got human rights defenders very worried. To tell us why some of the efforts being taken by the government to fight COVID-19 have got them worried, we have got Dr. Adrian Juco, the Executive Director of the Human Rights Awareness and Promotion Forum, and he joins us right now in studio via Skype. A very good morning. Yes, welcome back. We hadn't established a live video feed with Dr. Adrian Juco, who is going to be joining us via Skype. But let me just go back to the preamble that is getting us into that conversation. The United Nations AIDS agency is calling on countries to adopt a human rights-based approach in responding to the global outbreak of COVID-19 that puts communities at the center and respects the rights and dignity of all. In Uganda, claims of abuse of human rights, suspension of non-emergency court sessions, and the continued stay of prisoners who have served their sentences, among others, arising, have got human rights defenders like Dr. Adrian Juco, the Executive Director of the Human Rights Awareness and Promotion Forum, very worried. And he joins us via Skype. A very good morning, Dr. Adrian Juco.
Good morning, Romeo.
Yes. Tell us, what does the United Nations AIDS agency mean when they say that human rights principles must be at the center of the COVID fight? Help us expound on that with examples.
Thank you very much. Right now, I would say everything is about human rights, and that's important because usually human rights get violated when we have crises like the current crisis on COVID-19. So when they actually say human rights should be at the center, that means that human beings, human dignity, humanity must be respected even as we fight COVID-19. It doesn't serve any purpose for more people to die out of abuses by security forces than out of COVID-19. Doesn't make any sense. But also, it's not just about death. It's also more about respecting people, respecting individuals, even as we fight such a big pandemic. In fact, it's in such cases that we need respect for human rights much more than any other times.
Mm-hmm. We've seen LDUs continue to whip people during the curfew hours and some other scenarios. Is that one of the scenarios where human rights are being abused?
Absolutely. You can't, curfew hours are good, yes. And I appreciate the state has put in place measures to prevent the spread of COVID-19. I think we are looking more at prevention rather than treatment, which should be good. But although I think the horse has already bolted because we can't do prevention when we already have cases of COVID-19. However, if curfews are imposed, these curfews have to follow the laws. They have to follow guidelines. What I want to make clear to everyone is the government of Uganda has not yet declared a state of emergency. That is important because this means the government of Uganda is committing to protect and respect human rights even at the time of this crisis. That means people cannot be beaten, the right to dignity, but there are even rights that cannot be derogated from. For example, the right to dignity, freedom from torture, inhuman and degrading treatment, the right to fair trial. Those cannot be derogated from. In other words, there's no circumstance under which people can be beaten up by security agencies under curfew because of the curfew. That can't happen.
Dr. Juco, right now courts are being selective on who gets tried in courts of law. Now, what happens to someone who gets arrested during these trying times of COVID-19? Is due process suspended until the end of this outbreak?
And Romeo, we have a real life example where I work, Human Rights Awareness and Promotion Forum. We are currently following up a case of 20 people who were remanded to prison. And what has happened is that we can't, as lawyers, we are not able to access the prison to actually assist our clients process bail and other issues. And if you come to think of it, if we are really fighting COVID-19, then we ought to be dealing with the issue of congestion in prisons. We should be releasing prisoners rather than arresting more people under the COVID-19 rules and orders put in place by the president. So for me, I think this is the wrong approach that we're taking towards handling this crisis. We have to respect human rights. We have to make sure that the prisons are decongested. Petty offenses, people who have committed small crimes that are punishable by less than 1 year imprisonment should really be released from prisons instead of being taken to prison. And that's very important. At the same time, the courts are not working at their full capacity. And also what they call serious offenses are offenses that are seen as what I would regard as big offenses. These are not going to decongest prisons. We need the offenses to be worked on to be offenses of violation of these orders and directives, offenses that concern petty offenses. Those are the offenses that will decongest prisons. And police cells, absolutely.
How about prisoners who should be out of jail but are still stuck in there because of the transportation ban?
Absolutely, that should also not be happening. That should also be happening because that increases congestion in the prisons. So what I wonder about mostly is why we put in place measures without thinking through how they're going to affect everyone else. This pandemic is a crisis, yes. It's something that we didn't expect to happen. But if you think back to November, if you think about our ties with China and other countries, didn't we really expect COVID-19 to reach Uganda? What were you doing all those days to prepare for measures to take to avoid the spread? So we can't have the excuse of it's new, it's a crisis. These have been 5 months or so of this crisis. We ought to have a handle on how to handle it right now while respecting the rights of everyone else.
Mr. Juco, I've also been reading that a human rights approach would also frown upon a blanket compulsory travel restriction and criminal sanctions against these people affected by the pandemics such as COVID-19. But Dr. Juco, how do we fight COVID-19 successfully without taking these hard decisions?
No, there's no problem with taking hard decisions. There's a problem with violating human rights as you take hard decisions. I'll tell you, for example, the right to liberty. That's a right that can be limited in circumstances where we have to prevent the spread of contagious diseases like COVID-19. Absolutely. That's why I'm home right now. That's why people are at home, because the right to liberty has been restricted. No one is really shouting about that because that's important. However, in the restriction of the right to liberty, what happens? All right, which otherwise are being violated as we restrict the right to liberty. For example, I'll talk about vulnerable people, people who don't have what to eat, the border riders, the taxi drivers, the people who sell things on the streets every single day. If you take them off the streets, what does that actually mean? What does being at home mean? Me and you perhaps can afford to be at home. I can sit in my home and be fine. I have stocked up food. How many people in Uganda have actually stocked up food?
Good question.
And if you look at the government, already we have a lot of controversy around food distribution. And of course, we know very well, this being Uganda, corruption is going to become rife as they distribute food. So you have to respect human rights and human dignity. You can't tell people stay at home if they cannot be able to afford a square meal. And if you tell them to stay at home, then you should provide that meal every single day as a matter of right, not as a matter of privilege.
Dr. Juco, the meals are coming off the weekend, but under international law, governments have an obligation to protect the right to freedom of expression, including the right to seek, receive, and impart information of all kinds, regardless. Won't this lockdown affect all this?
I don't think it should affect all this. And that's the most important thing. There's no reason why a lockdown should affect people receiving information, people expressing themselves. Why should it? Why? Expression is just about respect. You know, it's a right, it's a civil and political right. You just need to step back and respect the right. Journalists have to be allowed to practice. They have to be able to go around and collect news. That has to happen. So it doesn't have to happen selectively. It has to happen as a matter of necessity, as a matter of obligation. The government of Uganda is under obligation to respect human rights. It doesn't do it because it's a nice government. No, it does it because it must. You know, it's an obligation on it. It's signed to international instruments where they must respect these rights. So yes, they have to do their work. They can't be beaten up when they're doing their work. You can't be stopped and limited from doing your work. That can't happen. We need information, and information is critical and key in the fight against COVID-19.
Many human rights defenders also contend that this lockdown and other measures such as the curfew should have been instituted as fast by declaring a state of emergency. Do you agree, Mr. Adrian Juco?
Right. On the issue of state of emergency, I'll have to go a bit slow. People have to go a bit slow on declaration of state of emergency. State of emergency has bigger implications. A state of emergency means that most of the laws, most of the rights will actually be suspended. There are about only 4 rights in our constitution that cannot be suspended: the right to habeas corpus, the right to fair hearing, the right to dignity. Those cannot be derogated from. So that means that if we allow a state of emergency in Uganda, it means that we'll have a justification to violate human rights without legal liability. So for me, I would say what the state has done is the right thing. No declaration of state of emergency, we still respect human rights. However, you have to respect them. Because you have not declared a state of emergency, you can't derogate. You cannot violate rights during the enforcement. I don't see why rights have to be violated in this process. You don't have to beat up people. You don't have to beat up people for goodness sake, for you to be able to enforce this curfew and other things.
Very good argument, Dr. Adrian Juco. But then Human Rights Watch says that governments should be slow in implementing the draconian Chinese-style lockdowns. But we saw what happened to Italy when they took long, and Spain when they took long to institute these Chinese-style lockdowns. Now you know what is happening in the country. It was too late. So what exactly are we supposed to do to walk this tight road, Mr. Adrian Juco?
I also have a feeling it's already too late in Uganda. It's not. But I think with 44 cases, and the cases are rising exponentially,
I think it's now 45.
We should now think about treatment. We should think about the right to health. What does it mean? Where is our specialized hospital dealing with COVID-19? Where are our services, the social services? If we have a full-scope breakdown, a outbreak over COVID-19, where is our emergency response? How do we proceed from that? So for me, the lockdown may be a good thing. Chinese-style lockdown maybe not. However, I don't also think it will be a very effective way of preventing COVID-19 from spreading. I think now with 45 cases, we need to think treatment. Where is it?
Then how best can we implement these measures without trampling on people's human rights?
Well, I have a feeling that government is made up of professionals who are trained to enforce laws. They're not trained to beat up people. They're not trained to stab people to death. They're not trained to do any of these things. The state has an obligation to train its law enforcers in such a way that they can respect human rights. I don't think the policeman, the only job they have to do is to beat up people. I don't think that's what it means. They have we've not seen beatings of people happening in many of the democracies in the world. Why? They have been able to contain as far as possible the extent of the spread. So Uganda can also do it. Just desist from doing things that violate people. The right to dignity, privacy. I had the president speaking of domestic violence, by the way, and saying that cases of domestic violence shouldn't be reported during this period of time. We are talking about disproportionately affected by the COVID-19 measures, and these include women. Women take the brunt of all sorts of things. With men staying home, more cases of domestic violence are bound to increase. But also women have much more needs, access to reproductive health rights and services. We have people living with HIV/AIDS who need to access their services, their drugs. We have the right to privacy, which shouldn't really be restricted. People have to tell RDCs of what ails them. You have to tell the chairperson of what you're suffering from for you to be able to get to a hospital. Where are the ambulances?
Yes.
How are they supposed all these things the state has to provide. The state cannot run away. What is money doing in infrastructure right now? What is money doing at State House, for goodness sake? Money should come to health right now. We should be able to provide for people, give services, protect the most vulnerable at this moment.
And of course, we can talk about the issue of stigma and discrimination. I was reading an article yesterday from the United States, and it was saying that many people who are Asians are now being attacked because people think they have the coronavirus. According to the NYPD, they've arrested 7 people for those attacks. When you come to Uganda, that issue is also rising up, the issue of stigma and discrimination. People are not trusting people who are in quarantine or people who have just left quarantine. How can this issue be best addressed?
I take you back to the state. What is the state's role? Sometimes I wonder how much Ugandans really feel the state has a role and an obligation to play. Quarantine, I know it was usually, before it was at the cost of the person who has been put in quarantine and all the things, but protection of people is important. What has the state done when it had cases of beatings of people who have come from quarantine? What has the state done when people start threatening the rights of others? The obligation to protect human rights still lies on the state. So as they're stopping cars and beating up people who are violating the curfew, they should be able to protect who have been released from quarantine. That's what I talked about. That's what I meant when I talked about measures. What measures are in place, generally speaking, to quarantine people? What measures are in place to treat people? What measures are in place to protect people? Because there's paranoia, people fear, absolutely. But that's why we have a government in place. Because government has to rein in all sorts of characters, or people who violate rights. And this is the obligation of the government to do that. So if people are being beaten by other people, are being violated and discriminated, the state has to come in and play its role. Instead of arresting people found in houses who are not even violating the curfew, they should be arresting, not arresting. Arresting is not the right thing at the time. They should be making sure that they actually impose sanctions on people who violate rights at this point in time. Don't take them to prison. Prison is the wrong thing.
In a nutshell, Dr. Adrian Juco, we are wrapping up this conversation. The viewer would like to know what are their rights moving forward as far as the COVID-19 pandemic is concerned. Give us a few pointers.
Right now, people still have every single right. Maybe the right to liberty, which is being restricted under public health laws, is the only right that will be restricted. However, every right, freedom from discrimination, the right to health, the right to food, the right to health care, even the right to education. But interestingly, that kids should still be not go to school, and should still be accessing services that will enable them to grow during this period of time, to go in their learning. So it doesn't mean that we simply should be banning things. We should be banning things at the same time. We should be making sure that there are measures in place to respect and protection. So people shouldn't sit there and think, oh no, I don't have this right anymore. You actually do have it. Even the right to liberty, people can still walk to town. That's a good thing. You can still walk, you can still ride a bike, maybe not a car, but also for emergency, for important services. For example, if people are being arrested by the police and they're being put in prison, why aren't lawyers working on legal aid being allowed to practice, to access their clients? Not every lawyer. We're not talking about land matters right now. We're not talking about other matters. We're talking about issues of human rights, issues of police beatings, issues of police violations, issues of arrests. Such lawyers should be allowed to access their clients, should be allowed to speak to the state, should be allowed to engage the state on violation of human rights. So no right is suspended at this moment. There's no state of emergency. Except the right to liberty is limited a bit, but not entirely.
Great insights, Dr. Adrian Juco. Thank you very much, the Executive Director of the Human Rights Awareness and Promotion Forum. He was expounding on the fact that some people were thinking that their rights were obsolete during these COVID-19 times, but as Adrian Juco rightly put it, you still have your views and they are valid. Your rights should be respected during this time. Now you're in the know. Let's run a short break. We'll be right back with more information.
You're watching Morning at NTV.